Hi, this is Dr. Antolak from thegentlendentist.com. We're your Macomb County dentist located in Shelby Township, and I want to talk to you why it's important to see a dentist on a regular basis. And regular can mean a number of different things to a number of people. Regular as far as if you're healthy, in your oral condition, it might be once every 6 months. And it could be, if you're unhealthy, once every 3 months. Why the difference? Why the disparity? And the reason why is we are dealing with different situations with people. You know, people are all different, and their biologies, their health, their genetics, if they're smokers, all these are factors that affect the overall health of someone's oral condition of the mouth. Let me explain. So, somebody who's healthy, let me explain first of all what one would expect when they come in to get a dental visit, a checkup, for example. Me as a dentist, I will first of all, during the exam, we'll call palpate, and we'll put pressure on the neck here. We check the thyroid. The thyroid gland is a gland here that controls the amount of your metabolism. Sometimes if you have an enlarged thyroid, that can affect the weight. Then we check in this neck area right in here, and in the neck area, that's where we have lymph nodes. These lymph nodes could be an indication of an infection somewhere in the body. We also check under the neck here, because lymph nodes also exist there, and if there's large lymph nodes, then I may refer you to your physician, because these could be an indication that you have an infection somewhere in your body that you're not even aware of, which could be potentially be life-threatening. We'll then go ahead and feel the side of your cheeks. You have what's called a parotid gland, which is a gland that's your saliva gland, and that's located in the cheeks here. We also then will feel along the head and the outside of the head, which is an area where the muscles, your muscles that you squeeze down on are, put pressure there, find out if there's a history of headaches. Sometimes people aren't even aware of the amount of headaches that are there. They just kind of get used to it. But if we can do some things to dive a little deeper, we can determine that. We also feel for the jaw joint. In the jaw joint, if it's healthy, you can open and close it, and there's no clicking at all in your jaw. That's a healthy jaw joint. Then we go inside the mouth, and we look at all your soft tissues. We look at your lips to make sure there's no growths at all going on there, to make sure that the glands, that your saliva glands, if everything's functioning normally. Then we do a very important part. We do an oral cancer check, which is where we pull the tongue back, we look at the sides of the tongue towards the back, and we may feel in that area, and that indicates the health. So oral cancer is the most common area, is in the back of the tongue, underneath that area. We'll go ahead and look, and usually it appears as if it's a white or a reddish type of lesion. If there's something that we see, we will observe it. We'll take a photo of it, a digital photo, and then we'll have them come back. If it might be trauma from biting the tongue or something like that, then that will go away. If it lasts, we may refer to a specialist, or we might do what's called a biopsy, brush biopsy. Okay, so this is all still during either your initial examination or your periodic examination that you get every 6 months. We're not done yet. We'll then look at the palate, the roof of your mouth, and making sure there's nothing going on up there. Then, after we get done doing these things, that's all soft tissue. Then we'll start looking at the teeth themselves. We'll see if there's any cavities, we'll see if there's any cracks in your teeth, and then make recommendations based on that. So obviously there's a lot of things that are examined on a routine checkup exam that we do, and I do that on every patient every single time. That way, if early prevention is the most important thing. So we make sure that during these exams, that if there's any signs of oral cancer, that we nip that in the bud and we take care of that as soon as possible. It's like the 5th leading cause of cancers, and that the reason why that is because many times it's not diagnosed. It's not diagnosed, and it's us as a dentist. It's our responsibility to do so, and it's your responsibility to come in so someone can evaluate that. Physicians are not always educated, nor are they trained to have that ability to discern what's happening for oral cancers, and the like, which I described. That's not even including getting your teeth cleaned, which is really important for the health of the gum tissues and long-term success and long-term use of your natural teeth so that they last you a lifetime. There's obviously many things I described here. Each one, there's a potential of having something happen in a negative fashion. So it is important to come in every 6 months for that. If you have periodontal disease or gum disease, then every 3 months is an important factor, because 3 months, research shows that every 80 days, bacteria that cause gum disease will replicate and will reattach and recolonize at these deep levels and start metabolizing bone, and the enzymatic system where it actually starts to dissolve the bone will continue. So there's a reason for that. So you will notice that either you have 3 month, 4 month, 6 month time frames to come in so you can retain your teeth as long as you can for a lifetime. If you are a denture patient, for example, we try to see them once a year. And the reason why that is, we like to make sure there's nothing happening in their soft tissues, which are potential for having cancers or any other types of malfunctions or dysfunctional areas in the mouth. So no matter what, it is important to come in on a regular basis. So if you haven't been in, and right now when I'm recording this is the month of September, get in before your insurance actually runs out for the year, if you have insurance. And it would behoove you to take action right away if you're having an issue. So if you do not have a Happy Dental home, we can help you provide one for you by calling 586-247-3500, and The Gentle Dentist is our website. Thank you. Have a blessed day.